Some of the greatest challenges around the first dose with the tackle box system was one, accountability of the drugs coming up missing, especially on the controlled substance drugs, where we couldn't ever track where they went, who they were used for. So that was a big challenge we always had with it. And then just the constant availability of getting drugs and e-kits replaced and replenished and transferred out were very difficult. CubeX integration with our pharmacy system is fantastic. We work with Framework by SoftWriters, and the integration has worked out very well since we started with CubeX 1 year ago. The number one reason we chose CubeX over competitors is because of the background integration that it does have with Framework. But a patient being able to come right into the community, getting a first dose of a pain medication, antibiotic, blood pressure meds, whatever it may be, until that next pharmacy delivery comes on schedule, is just huge for patient care. CubeX has helped me be able to win customers. I was just told last week we're getting 4 new communities because of what we're doing with CubeX and the ability to be able to put controlled substances in CubeX, and that's where they pull every controlled substance from. So for those communities, I will only be dispensing 5 to 10% of the total controlled drugs. CubeX implementation was very smooth, it was very nice. It definitely takes some time, it takes a lot of labor up front to load the machine, do the training, but it's all well worth the time. More time, every hour you put in up front to do it right saves you 3 hours down the road in on-call deliveries and everything else that goes along with it. The most important part is when you take the time to do it right and get it done right, it's amazing how well it works. From our standpoint, the state of Kansas has to relate around med destruction. A pharmacist has to be present to destroy controlled substances in the state of Kansas. Therefore, if we're removing every dose from CubeX, med destruction is decreased almost 100-fold of my time going out and destroying meds with the DON, RNs, and other staff members. So for that, it's a huge win. If you took my CubeX away today, I would have to go back to tackle boxes, and it's just not an option. You can't take my CubeX away today.